Treatment for trigger finger, I think, is patient-directed, depending on, number one, how long the symptoms have been, how bad they are, patient's goals, also sometimes their individual medical conditions. The early treatment is a steroid injection. We think steroid injections are pretty effective for most patients with trigger fingers. But for many people, that can be a cure. We do an injection or a series of injections and the symptoms ultimately resolve. So vast majority of trigger finger surgeries, we can do local anesthesia, patient wide awake in an office-based procedure room. We'll numb up your finger with a small injection, kind of similar to the steroid injection, but this time using primarily a local anesthetic. Numb up your finger right over the planned incision, and then transfer you to a procedure room where we do the procedure with the patient wide awake. So make a small incision about 1/2 inch to 1 inch long in the palm over the finger that's catching. I'll dissect down and see that tunnel of tissue that's wrapped around the tendon that's making that tendon stiff and catch and lock. Think of it as a mechanical issue where that tendon is getting caught in the tunnel, and if we open the tunnel, then the tendon should slide through better, and in most cases that triggering and catching and stiffness goes away. I will have the patient move that finger actively, stretch it out, full tight fist. Usually have you do that a couple times so you and I can make sure that there's no catching, there's no stiffness, there's no locking, that we have taken care of the problem. Once that motion's good, I'll usually put 2 or 3 stitches in the palm to help close up the wound. Put a soft dressing. There's no splints, no cast, no brace. Once we get your wound all covered up, the patient's good to go. We make an appointment for follow-up at about 10 to 14 days. I'll give patients a set of instructions afterwards to work on specific finger range of motion exercises, but I want you to do day-to-day activities. I tell you, go home and anything up to about 1 pound or 2, things like feeding and clothing, writing and typing, might be a little sore or awkward, but are very safe and good to do. 90-95% of people get complete relief of the triggering, the locking, the catching. There is a small recurrence rate, a little more common in people that have some of those associated medical conditions like diabetes or rheumatoid arthritis, but for most people, recurrence rate's very low. My job is to get it free during surgery. Patient's job is to keep it moving and do those exercises after the surgery to kind of maximize our outcome.